Well, hello, everybody. My name is Chloe Sledge, and today I'll be discussing hospital social work. I'm really interested in working in a medical setting, and hospitals just really seem to catch my attention, and I've really enjoyed learning more about them throughout this class. So, to begin the presentation, I will just kind of go over a case story. So, the setting is downtown Austin, where a young man begins to have a meltdown in the middle of the street. He's shouting to call 911 and collapsing to the ground. He's rushed to the hospital where they determine that he is experiencing psychosis. The next time the scared young man woke up, he found himself in an empty room with plain white walls. The client ended up in a state psychiatric hospital, hundreds of miles away from home. The family reported that this young man has never behaved in such a manner. Him and his family report that he is experiencing an allergic reaction to a pain medicine, and he was given after dental surgery. However, authorities did not believe him or the family and sent him to an unknown facility without the client's or the client's family permission. While at the psychiatric facility, the client was diagnosed with schizophrenia and given several new medications that left him with uncomfortable symptoms. Once the client left the facility, he was facing flashbacks and feelings of hopelessness and anxiety. It was later found that the client does not have schizophrenia, but he's very allergic to oxycodone. The allergic reaction caused him to become paranoid, sleep deprived, and experience delusions. The outcome to this story could look very differently if the client were to have had a social worker advocating for him. A social worker would have been able to assess the patient further to discover the possible reasons that he was. So the population served within the hospital setting can look very different depending on the hospital, the department, and the location itself. So oftentimes, of course, the patient demographics will match that of the local area. So as you can see in Austin, the majority is white for the racial group, and the next is Hispanic population. And so this will tend to be the same within the hospital setting. But of course, there are differences, and it can, it definitely depends on the area. So hospital social work can look vastly different depending on the department and the hospital itself, of course. But the team can be comprised of doctors, physicians, nurses, dietitians, religious leaders, respiratory therapists, social worker, other mental health professionals, and other medical professionals and staff. So within the emergency department, you might have like a triage nurse, emergency room technicians, doctors, physician assistants, lab technicians, and a social worker. So as for models that are used within the hospital setting, it definitely depends, again, on the hospital and the department and the team. But I chose the medical model, holistic model, and the consensus model. So that medical model is the traditional model that doctors and nurses and other medical professionals use. This model likely will focus on the presenting problem of the client or the patient and focus on a solution, a quick solution to that. So if a patient comes in with a broken arm, they're going to focus on that arm. The holistic model is that model that social workers generally use. And so this model looks at the entire person. So while they might also look at that broken arm, the social worker is going to consider their discharge planning and what systems does this individual interact, and do we need to make sure that they have support at home for their aftercare. And so the consensus model is a model that is used in interdisciplinary teamwork. And so this model really just encourages joint decision making and making sure that the social worker, the doctors, nurses, anybody on the interdisciplinary team, they make decisions together and their decisions are weighted equally. So advocacy is a very important piece in social work, and that is no different in the hospital setting. Social workers can make large impacts by advocating on a macro level and just within their agency. In Austin, social workers can partner with NAMI, National Alliance on Mental Illness of Central Texas. And NAMI advocates for mental health awareness, and they also will have charity events and try to raise money towards mental health needs in this area. And social workers can attend these advocacy events spread awareness in their own agency and community, and also call their state legislators. Social workers can use their advocacy and communication skills to make a large impact in their community. So in the state of Texas, people can be forced into involuntary commitment if they are deemed a threat to themselves or others. And the mental health code is contained in Title VII, Subtitle C of the Health and Safety Code. This process for involuntary commitment is rather quick and can be very stressful for the patient. Hospital social workers are often called to assess whether a patient needs involuntary commitment. And in this situation, the social worker must recognize the weight that their assessment has on the patient and the community. Committing a patient that does not need to be committed is unethical, but failing to commit a client when necessary can also be harmful to others and the client itself and unethical. And so again, social workers really must understand the weight of this process and the importance of taking time in the assessment to make sure that they make a good decision. So the legal implications on hospital social work. Social workers must make quick and accurate decisions throughout the assessment process. Social workers also must be familiar with their agency, local, state, and federal laws. So for example, in the state of Texas, hospital social workers that are using state funds and federal funds must track their progress and how their budget was spent. And if a social worker fails to meet this requirement, then that department can lose their funding, which obviously would have really negative impacts and implications on that hospital. So social workers are very essential, and they bring a unique and important perspective in a hospital setting. As earlier I mentioned, the holistic model, and this model is really empowering and also allows social workers to encourage their interdisciplinary team to consider a client in all their systems, their biological well-being, their psychosocial needs, and their spiritual needs. And so social workers bring that unique perspective. And social workers also make huge impacts on their team and community. Again, that unique perspective helps them to do so. And also the advocacy skills are so important in the hospital setting and allow social workers to advocate for patients' rights and advocate for what the patient wants. And so hospital social work is something that I feel very passionate about and very excited to learn more about in the future. So thank you for listening.